that is Tapyadi Loha. We have just seen that Ekanga Viraras is for Margavarodhajanya and Tapyadi Loha is for Dhatukshayajanya Vata Prakopa. So very good combination today. One is for Margavarodhajanya and one is for Dhatukshayajanya. Tapyadi Loha is also called as Yograj. Yograj, another name. The reference is from Charak Samhita 16/82. Tapyadi Loha, another drug I am describing after Ekanga Virarasa. Tapyadi Loha is also available with Vaidyanath, and especially Vaidyanath, it approximately 5 gram packet is costing you 60 rupees. It is not costly, it is cheap. Both Ekanga Virar is also cheap and Tapyadi Loha is also cheap. Only remember, Bruhatva Chintamani is not cheap. It is very, very costly. Okay? Tapyadi Loha, it is a Khalvi Rasayan. You have to just triturate all the ingredients. There is a Trifala Churna, 3-part, Trikatu, Trifala Trikatu is always there. 3-part, Chitraka Churna, 1 part, Vaudinga 1 part, Shila Jatu, 5 parts, Raupya Silver, Raupya Bhasma, 5 parts, Suvarna Makshika Bhasma, 5 parts, Lauha Bhasma, 5 parts, Khadi Sakhar, sugar candy, 8 parts, and Bhavana Dravya is honey, madha. So it is approximately 1440 ml. 1440 ml. Because in the text it is mentioned 144 tole. You know 1 tola is equal to 10 ml. That's why I have said 1440 ml. cc. Now, basically this is Ekanga Viras is also given, for example, at the dose of 1 BD. I have forgot to tell you about the doses. It of course depends on the situation, that means the patient's strength, disease strength, and then we decide. But in general, Ekanga Virarasa is also given 125 milligram to 250 milligram. 125 or 250 milligram, that means 1 or 2 tablets at a time. It is also given 1 or 2 times in the beginning, but afterwards as a rasayana, after 8 days or 10 days, it should be given as a course of 21 days. Ekanga Viraras should be prescribed 1 or 2 tablets only in the morning, that is rasayana kala. On empty stomach it is called as a rasayana kala. With Ardraka Rasa and the ghee. Ardraka is a wet ginger juice. Wet ginger juice plus ghee. For example, 1 spoon of this and 1 spoon of that. Just crush the tablets, mix it and take the sartan. So Ekanga Viraras, traditional system of giving the medicine, Rasayanakal, 21 days for the patients of hemiplegia having Kapha-Vata origin. Now coming back again to our routine present discussion of Tapyadi Loha, reference is Charak Samhita 16, chapter number 16, Charak Samhita. Then its indication, what the Charak has mentioned about the Tapyadi Loha. But first let me clear why the name Tapya. Tapya is a Suvarna Makshik. Write down, very essential. Tapyadi Loha. Of course it contains the Loha Bhasma, that is iron. But what is meant by Tapya? Tapya is a Suvarna Makshik. Suvarna Makshik is Makshika Bhasma, that is Tapya. So that's why the name Tapyadi Loha Vati. Vati is a tablet. Charak says, indication, Pandurogam, Visham, Kasam, Yakshmanam, Vishamajvaram, Kusthani, Ajirnakam, Meham, Shosham, श्वासम अरोचकम विशेषात हंती अपस्मारम कामलाम गुदजानी च. It is always asked why the student should recite the shlokas. This is a very famous question by the students many times. Why we should recite the shloka? That is because it is like a programming of Ayurveda. Because in a short lines you can remember many of the indications. If you have to remember one by one, it's very difficult. So to remember all the contents in a very few lines, it is always work hard on this remembering the shlokas. So I repeat these shlokas by Charak, but giving the translation. Pandurogam, anti-anemic or hematinic. Visham, antitoxic. Visha, any wish. Food adulteration, air pollution, sound pollution, water contamination, any wish. Visham, antiseptic, antitoxic. Kasam, anti-cough, COUGH. Yakshmanam, anti-TB, anti-cox treatment, Tapyadi Loha. Vishamajvaram, debility due to malaria, debility due to typhoid, Vishamajvaram. Kusthani, remember, Ayurvedic word kushta, it not only leprosy. All skin diseases are called in Ayurveda as kushta. Because there is a confusion in the minds of the common people. When you give the lecture to the common people, they say Tapyadi Loha is kushtagna. It is only for leprosy. No, it is for many skin diseases. Kushta, ajirna, indigestion, meha, prameha, many urinary disorders, including diabetes mellitus, which is madhumeha. Meha word means prameha. Prameha means many urinary disorders, including diabetes mellitus, that is madhumeha. Clear? Next word is shosham, weight loss. Cachexia, muscle loss, fat loss. Shosha is a degenerative phenomena. Mainly shosh takes place because of 2 or 3 important diseases. Shosha takes place because of the TB. But it is already explained. Shosha takes place because of many cancers, malignancy. So that is also shosha. Shosha takes place in HIV patients. So that is also included in shosha, AIDS. Tapyadi Loha can be given to the HIV patients, AIDS patients. Shwasam, very useful for problem of breathlessness. Shwasa. Or dyspnea. Diva, S-P-N-O-E, dyspnea. Including tamak shwasa. Tamak shwasa is bronchial asthma. When I say only shwasa, shwas includes many conditions having breathlessness. One of the important condition is tamak shwasa, that is bronchial asthma. Next indication, arochaka, anorexia, loss of taste in many diseases, use Tapyadi Loha. Visheshat hanti apasmaram, convulsions, especially epilepsy. Tapyadi Loha is anti-epileptic. Then kamala, infective hepatitis or jaundice, kamala. And gudajani, many anorectal problems. You can use Tapyadi Lohavati mentioned in Charak Samhita, chapter number 16. Let us start the discussion of contents and action. important content is Shilajit. Shilajit is one of the best rasayana. Shilajit, black bitumen. Utkrishta, best rasayana, tonic. Especially indicated in Panduroga, that is anemia, and Pramehanashaka, useful for diabetes, controlling the blood sugar. So Shilajit is the best rasayana for diabetic patient. So Tapyadi Loha tea should be given for diabetes. Raupya Bhasma, Vata Shamak, Nervine tonic. Raupya is a silver. Raupya Bhasma is a nervine, NER, good for nervous tissue, good for brain, good for neurons, good for axons, good for dendrites. Raupya Bhasma, silver. Majja and Shukra Dhatu Vardhaka. Majja is a nervine tonic, also useful for bone marrow. Ayurveda says Majja Dhatu can be compared with two elements. Majja Dhatu is mainly nervine tonic or the nerves. Another Majja, Saraktameda, is bone marrow. So, Raupya Bhasma is also good for erythropoiesis, hemopoiesis, making your blood very good. Hemoglobin will raise. It is a balya, anabolic. Silver is a balya, tonic, rasayana, rejuvenator. Next is the Loha Bhasma. Loha is iron. It is Raktavardhak, hematinic. Loha is iron. Panduroganashak, anti-anemic. Balavardhak, strengthening your stamina, increasing your body strength. Rasayana, rejuvenator. Suvarnamakshik Bhasma, very similar to the Loha Bhasma. Both the properties same. Triphala. It is a Vatanulomana, best laxative. Deepana, that is digestant. Pachana, carminative. Deepana Pachana. Triphala is also Kledanashana. Remember another property. Kleda. Kleda is a waste product developed at the time of tissue metabolism. Ayurveda believes that clade, what is exactly the clade? There are different, unwanted, very subtle waste products are created at the tissue metabolism. For example, I have already given you 100 times example. Urea is one of the clade. Excessive sugar in the blood is a type of the clade. Remember. That's why, as it is a Kledanashan and digestant and laxative, Triphala is supposed to be the best rasayana, Sreshta rasayana. Tarunya Vardhak, that is anti-aging. After the age of 40 or 50, everybody can take the Triphala tablet early in the morning, one tablet as a rasayana. Hirda, Bheda and Amalaki, these are the contents of Triphala. Phala are the fruits. Katu. Tri means three and Katu means pungent. These are the three spices in all medicines of Ayurveda. Suntha, Maricha and Pippali. Suntha is a ginger, Maricha is a black pepper and Pippal is a long pepper. These are the best digestant and carminative, Deepan Pachan, Amapachak. Then there is a Chitrak and Vauding. Chitrak, the synonym is Agni. Chitrak is the best for Agni Vardhana, stimulant for your digestive juices, digestive fire. There will be very good secretion of pepsin and pepsinogen, chymotrypsinogen, erepsin, all the enzymes from the gastric juice, from the pancreatic juice, from the intestinal juice, each and every digestive juice that glands will be stimulated by the action of Chitraka plumbago zelanica is the Latin name. Plumbago zelanica. Vauding. Another is a vauding. Vidang is a anti-helminthic, anti-worm. So, whenever there is a microorganisms pathological in your GI tract or anywhere in your body, that microorganisms will be killed by the action of vauding. They will be destroyed. Anti-infective, antiseptic. This vauding will act as antiseptic. And last is a madh, that is honey. It is kapha pitta shamak, controlling the kapha and pitta. Vishanashak, antitoxic. Ojo vardak, stimulant to your immunity. And the most important is yogavahi. Madh always carries the properties of the medicines. That is called as a catalytic action, and that is why many times Ayurvedic preparations are given with either honey or ghee or with the honey and ghee together. Am I right? So this is yogavahi. Now this Tapyadi Loha can be given again, for example 2 tablets as a rasayan every day morning for 42 days. For 42 days, double than Ekangavira. Of course, Rasayanakal, Anannakal. Then it is also taken with the honey and sugar. So let us see some indications. But in general, what is the action of the Tapyadi Loha? As I have said, it is useful in anemia, in any type of the adulteration or the food poisoning. Of course, it's not in an acute condition. Remember, it will give the strength to your body or the body organs in a long-term way. It is not the acute remedy for anything. Tapyadi Loha cannot be said as a emergency management treatment. No. Tapyadi Loha is always best as a rasayana and to reset. Remember my word, R-E-A-C-T. Reset your disturbed physiology by getting corrected each and every element of your body. Step by step, step by step. In 1 week, 2 weeks, 3 weeks, 4 weeks. It will continue the process. And then after some days, you will get your original health and you will be 100% swastha person or the healthy person. But Tapyadi Loha cannot be considered as a acute management in any of these things, any of the conditions. So, basically it is acting on the stomach and the intestines. It stimulates the digestive fire. Stools will be alright. You will get the proper blood and all the 7 tissues. Ojo will increase. Your sensory and motor organs will be strengthening. And overall its effect is an anti-aging rasayana, anti-aging rejuvenator. Because it is improving the action of liver, spleen, heart, brain and kidney. All these organs functioning will be improved by the use of Tapyadi Loha vati, especially in the Pandu. Whenever there is a Pitta Pradhana clinical features, Pitta Pradhan symptoms, in the patients of Pandu, is the intermittent fever is there. In the patient of anemia, intermittent fever, intermittent burning, intermittent excessive thirst, intermittent stomatitis. Remember these 4 Pitta Pradhana Lakshana: Jvara, Dah, Trusha and Mukhapak. When anemic patient will suffer intermittent fever, number 1, intermittent burning, intermittent thirst and intermittent stomatitis, what is the best drug? Tapyadi Loha vati. This is the proper specific indication. Then, whenever there is a effect of any toxin on your body and your immunity has been gone down, then basically you can give the Tapyadi Loha vati to get rid from your food adulteration. Especially nowadays, there are repeatedly indigestion complaints, that this patient is suffering from chronic diarrhea, chronic constipation, chronic irritable bowel syndrome. All these are the common complaints, and the main reason is what we eat today than the previous generation is a low quality of the food. All the fruits, all the vegetables that we use are farmer on the basis of inorganic way. That means we are using the chemical pesticide and insecticide and some hormones to get the more growth of the herbs and plants and all these fruits. So that is very wrong, and that's are getting us the bad effects on our body, and we are becoming older and older very early. That is called as a premature aging. There is early your hairs are falling down. Am I right? Early graying of the hair, early wrinkles are there, and only we go to the cosmetic shops or the beauty parlors or the gyms and we want to improve. But the best way is to go for organic food, number one, and take the supportive medicine like Tapyadi Loha to get real anti-aging effect. Then there is a Rajyakshma, especially when this Rajyakshma has also developed because of your low immunity. That means basically the patient is suffering from a long run inorganic food consumption and he has exposed to the air pollution. Both are visha. One is coming from food, so immunity becomes low, and one day he has caught the mycobacterium tubercle infection from the crowded place because of the air pollution. So are you getting 2 points very clear? How the patient has come? Basically he has already lost his functioning of digestive tract because of wrong eating habits. His immunity is low, and one day all of a sudden he got the tubercular infection. And that is the best thing, that we can improve all his rasayana rejuvenation with the use of course you have to give the anti-cox treatment. You have to use either Ayurvedic or the modern drugs. For example, you can use Bruhat Shwasa Kasa Chintamani Ras. This is one of the best drug in the acute phase. You can use Nagaradi Kashai. Am I right? You can use the anti-cox treatment, streptomycin, ethambutol, isoniazid. But to preserve the original OJ immunity of the patient, the best drug, adjuvant drug, that is the Tapyadi Loha, you should prescribe for each and every tuberculosis patient. Then Vishamajvara, I have also already talked about you. Vishamajvara is a type of irregular fevers. It can be included your regular malaria. Then you can include the dengue fever. You can include the chikungunya, leptospirosis, swine flu, typhoid, paratyphoid. These are the various varieties of the irregular type of the fevers. Am I right? And in these fevers, always after the acute phase, within the period of, say for example, 5 days, comes out from the dengue. Patient comes out from the chikungunya. Patient comes out from the leptospirosis. Patient comes out from the swine flu. Patient comes out from the malaria. After 10 days, patient comes out from the typhoid. But in all these fevers, convalescence period. What is the scientific word? Convalescence period. That is the post-illness. Convalescence. Very scientific terminology. Convalescence. And you might be knowing debility is very, very common problem in the convalescence period. Patient is so weak, next 2 months. Then the modern doctors give some B complex, am I right? Some Bayer's tonic, vitamin C. But what Ayurvedic Vaidya should give? Tapyadi Loha after the acute phase of your this type of Vishamajvara. Vishamajvara acute? No, I am not saying. It may be you can use the Parijata Guti. You can use any other antipyretic that are mentioned in the Ayurveda. But after fever, what is the debility has remained, weakness has remained, can be cured by Tapyadi Loha. Then Prameha, diabetes mellitus. There is also Kledha is more unwanted waste product at the tissue metabolism. For example, excessive blood sugar. there is a problem with the Rakta Dhatu, Mausa, Meda, Shukra and Oja. These are the Dushya. This is specific term in Ayurveda, Dosha and Dushya. Dosha are the vitiated pathological condition of Vata, Pitta, Kapha. And they attack on the weaker, W-E-A-K-R, weaker body tissues. And that weaker body tissues are called as a Dushya. So all these Dushyas are, what you can say, but here also you can remember, our traditional Vaidyas, they say that Santarpanajanya Meha, you can use the Tapyadi Loha. Santarpanajanya Meha. Because it contains Shilajit. Shilajit is reduced the anti-clade. Anti-clade. Shilajit is anti-clade. Trifala is anti-clade. And that is why Santarpanajanya Meha, whenever the patient is consuming lot of high calorie diet, fatty food, then you can use the Tapyadi Loha in these patients. Next is Kamala or the Kumbha Kamala, because this, as this is a very stimulant for the metabolic process, it is improving your digestion function, it is reducing the inflammation of liver, inflammation of the liver, it reduces the obstruction in the bile canaliculi, reduces the obstruction in the bile canaliculi with the effect of Shilajit, Trikatu, Chitrak. They reduce the obstruction in the ducts of digestive juices, and naturally the liver function is improving and the patient gets relief from the long run problems like ascites, portal hypertension, edema on the legs, that will be step by step reduced when liver function will improve. So whenever there is edema due to the hepatic problem, hepatic edema, portal problem, definitely you can use the Tapyadi Loha. Then again Kushtarog. Kushtarog is a skin problem. Why the skin problem is there? Ayurveda believes, Ayurvedic concept. There is a problem, low immunity in the skin. Remember, low immunity of the skin. Rasasar is equal to Tvakasar. Do you understand this thing? Rasasar is equal to Tvakasar. So, Rasa is the first tissue in our body, Rasa Dhatu. And how Rasa is formed? Rasa is formed after Ahara Rasa. And what is Ahara Rasa? First nutrient material. Am I right? Which is absorbed in the villi. Do you know? Proteins are absorbed as amino acids. Carbohydrates are absorbed as a glucose. Fats are absorbed as a fatty acid. Where? In villi. And that juice, that particular juice, in Ayurveda it is called as a Ahara Rasa. Am I right? So that Ahara Rasa is converted to the Rasa Dhatu, and Rasa Dhatu give the proper hydration to the skin. When this hydration has lost, when there is a problem in the Rasa and Rakta Dhatu, am I right? Rasa and Rakta both. You can use Tapyadi Loha. It is like Amruta. It's like ambrosia. Because last line in Charak Samhita, very interesting. Last line, Charak Samhita, 16/82. 16/82. What is the line? Yograj iti khyato yogo yogo ayam amrutopamaha. Write down this word, amrutopamaha. Amrutopamaha. So Tapyadi Loha is considered like Amruta. Amrut, what is Amrut? Ambrosia is the water of the God by which they can live alive. But our traditional Vaidya says, whenever you have the problem with the brain, heart and kidney, and you start using the Tapyadi Loha, okay? And if Tapyadi Loha is also not working, then there is no, what you can say, the prognosis is bad of that patient. Such an important drug is like a last treatment that you can try to prevent the loss of the patient or loss of the quality of the life. Better, how you can prevent? By prescribing Tapyadi Loha in the cases of Shira Hrudaya Basti Marma damage. Is it clear?